Hello, everyone. My name is Abhinav Arora. I am here with Aryan Arora. We are attending Syracuse University, and we will be going over a study conducted by Dr. Panjali, Deepjot Singh, myself, and Aryan. We will be discussing an alternative to lateral approach for sinus augmentation through the Crest. The domain of sinus augmentation has prolonged face challenges due to the intricate anatomy and the pneumatized sinuses. Traditional methods, while still effective, have room for improvement. Maxillary sinus augmentation procedures have come a long way since the 1970s. The real advancement lies in the ALSAC method, which combines the principles of older techniques with the finesse of modern tools like the magnetic mallet. The lateral approach, while a significant milestone, presents several complications. From high failure rates to risks of arterial injuries, there's a clear need for a safer and more efficient alternative. In our study involving 58 patients, men and women, the data indicates a compelling case for the ALSAC approach. Not only does it reduce complications, but it also ensures optimal implant placement. To understand the intricacies of ALSAC method, it's crucial first to grasp the traditional lateral window technique, which has been the gold standard for sinus augmentations for many years. The lateral window technique starts with an incision made in the mucosa to expose the lateral wall of the maxillary sinus. A full thickness flap is then elevated, revealing the bone. A small oval-shaped window is then created in the bone using a rotary instrument or osteotomes, ensuring minimal trauma to the delicate Schneiderian membrane. With the utmost care, the Schneiderian membrane is gently elevated off the bony floor of the sinus. The membrane is very thin and it's delicate, so it is essential to keep its integrity for the success of the graft. Once sufficient space is created, it's time for the bone grafting. The graft material, which can be either autogenous, allogenic, xenogenic, or alloplastic, is placed into the newly formed space. Depending on the residual bone height and the clinician's preference, dental implants might be placed immediately or after a certain amount of healing period, which usually lasts several months. Once the graft material has integrated and matured, the procedure is finalized by carefully repositioning the flap and securing it with sutures. Proper wound closures ensures optimal healing and reduces the risk of graft contamination. Post-operative care includes pain management, potential antibiotics, and avoiding any forces or vacuum in the area. Periodic follow-ups are essential to monitor the graft's integration and the eventual success of the implant. When juxtaposed, the ALSAC method outperforms the lateral approach in various domains. Notably, our results indicated a significant increase in final sinus lip height using the ALSAC method. In conclusion, the ALSAC technique, or the alternate to lateral approach for sinus augmentation through Crest, stands out as a dependable surgical option when its core principles are maintained. Compared to the traditional lateral approach, ALSAC presents fewer risks, reduced trauma, and boasts a superior resulting bone height. While minor post-operative complications can arise, they're typically manageable through medications or further surgical actions. Thank you.